How to withdraw drugs addiction. The drug problem is a global public hazard. Drugs that can be abused by people or substances with the potential for drug dependence. International conventions divide drugs with dependence into 3 categories. 1. Narcotic drugs. Opioids, cocaine, marijuana. 2. Psychotropic drugs. Sedatives, hypnotics and anti-anxiety drugs, central nervous system stimulants, hallucinogens. 3. Others. Tobacco, alcohol, volatile organic solvents. Detoxification and de-addiction. In the process of drug rehabilitation, drug addicts must first be allowed to successfully pass the acute withdrawal reaction period. This process is called detoxification. Detoxification is to relieve the physical withdrawal symptoms of drug addicts, get rid of the physical pain caused by drug addiction, and lay the foundation for the next step of rehabilitation. Detoxification is to eliminate drug addiction and relieve their physical and psychological dependence through drug treatment and rehabilitation process, so detoxification and de-addiction are not the same thing. Detoxification is easy, but de-addiction is difficult. People often have a misunderstanding that detoxification is drug rehabilitation. In fact, detoxification and addiction rehabilitation are 2 stages of the drug rehabilitation process. Detoxification is the premise of addiction rehabilitation, and addiction rehabilitation is the continuation and consolidation of detoxification. Drug rehabilitation must first be detoxification, but addiction rehabilitation is more important. How to view drug rehabilitation failure. From a medical perspective, drug addiction, drug dependence, is a chronic disease, and its protracted symptoms can last for months or even years. Mental addiction can also exist for a long time. It has a natural recurrence and relief process. Almost no drug addict succeeds in drug rehabilitation the first time. Therefore, drug addicts should not regard relapse after a period of abstinence as a failure of drug rehabilitation treatment, but should regard it as an indication of initial addiction and as a clue for retreatment. It is very important to understand and recognize this, especially to help enhance confidence in drug rehabilitation. However, it must be emphasized that drug addicts should not use this recurrence as a reason for their relapse and indulge in drugs and degenerate, but should create positive conditions for their successful drug rehabilitation. Is there a special drug for drug rehabilitation? Drug addicts and their families often have a mentality that they hope there is a special drug rehabilitation drug that can quickly, thoroughly and painlessly get rid of drug addiction. The answer is no. Because drug addicts are addicted to drugs, they not only form a physiological dependence, but also a more stubborn psychological dependence. Drugs can alleviate or reduce physical dependence, but mental illness is difficult to cure with drugs. Therefore, there is no panacea for drug addiction. Drug addicts should not be superstitious or fantasize about any special drugs for drug addiction. Only by making up their minds to carry out scientific and comprehensive treatment can they completely get rid of drug addiction. Why are drug addicts susceptible to AIDS? Drug addicts are mostly young and middle-aged, with low education and weak hygiene awareness. Due to the addictiveness of heroin, drug addicts usually take the path of intravenous drug use. When drug addicts have drug addiction attacks, they are always eager to push heroin solution into the vein. Due to poor hygiene awareness and the clustering of drug addicts, a syringe is often used repeatedly or shared by multiple people. As long as one person is infected with HIV, the virus can enter other people's bodies through this route. Another reason is that many female drug addicts use prostitution to support drug use in order to buy drugs. These people treat sexual intercourse as casually as home. These 2 reasons undoubtedly increase the HIV infection rate among drug addicts. Since humans have known diseases, few diseases have spread as quickly as AIDS. The harm of adulterated drugs. In order to make huge profits, drug dealers of all sizes often mix many kinds of adulterants into drugs, which constitutes polydrug abuse. Take heroin as an example. When it is imported in large quantities, the purity is generally around 80%. After being adulterated by drug dealers, the purity has been greatly reduced when it reaches the hands of drug addicts. It is normal to even be as low as 10%. Among the adulterations, phenylene hydrochloride is the most commonly added, followed by lactose, fructose, caffeine, procaine, ephedrine, nicotine, chloride, starch, talcum powder, magnesium sulfate, etc. Some even add cotton fibers. In recent years, Heroin seized in China has been found to be mixed with painkiller powders and headache powders such as barbiturates, diazepam, anaga, and salicylic acid. These adulterated drugs will increase the harm to drug users to varying degrees.